Would the clerk do roll call for us, please?
Francis Duncanson,
Here?
John Bonifaz,
Here.
Red Olson,
Here.
Kim Garley,
Here.
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 Dr. Arnie Lagas.
Okay, so that completes our roll call. And with that, I'll entertain a motion to approve the agenda.
I move to approve the agenda as presented.
Second. Okay, a motion's been made and seconded to approve the agenda. Any discussion? With that, we will, I'll call for a vote then. All in favor, say aye.
Aye.
Opposed, same sign. And motion is carried.
Hi.
Agenda item number 4, approval of the minutes from the May 13th, 2025 meeting. And I hope everybody has a chance to take a look at those.
I'll move to approve minutes from May 13th.
Okay, motion's been made by Garvey and a second.
I'll second it.
Okay, and the second by Supervisor Johnson. Any discussion? No. And so with that, I will call for a vote. All in favor, please say aye.
Aye.
Same sign. And the motion carries. Agenda item number 5, public comments for 3 minutes. Do we have anyone who would like to speak public here? It does not appear that we have anyone who would like to make any public comments. So with that, we will move on. Receipt of information from supervisors not seated as committee members. It appears that all the supervisors here are committee members. So I'm going to move on then to agenda item number 7. It would be our update regarding public nuisance ordinance and discussion. So Tanya has been working with Supervisor Garvey on that. And we will let you present then what our proposed changes are.
Well, we are not ready to present those changes as of yet. It's still in the Office of Corporation Counsel. So
Okay.
they're doing a final look at it. We will plan to bring it back at the July meeting,
Okay,
if that's okay, and then potentially public hearing at the August meeting.
okay, sounds very good. Thank you for all of the hard work that you have put into this and also for providing us with a draft of where you're working along so far. We appreciate that. Okay,
Madam Chair, can I?
yes, I'm sorry.
So our public nuisance, has this gone to the sheriff's office for review?
No, this is, it's more of a cleanup of the human health hazard with parts of that public nuisance being eliminated from our human health hazard specific to this committee. So I don't know if Sheriff's Department is planning on doing their own public nuisance, maybe you know more.
No, they can't do their own. They gotta be, we gotta have one. We gotta coordinate everything with sheriff's office and there's so many things that it's in the corporate council now. And because there's so many things in the privacy law and the sheriff's, what can you and what you can't do according to, private rights and everything. And as I read it, there's some things that are pretty controversial. Most of the things that I see in there have the public or public health officer has to address and defend.
Yeah, so that is what the Corporation Counsel's office is doing right now, is looking at the legalities of what we can and can't do.
Legalities is what
Yep.
the big word is.
Yep.
There's, people drive down the road and they look at this and they look at that. Well, if you're gonna issue a summons or something, then they've got to get a lawyer. We've got our corp counsel and everything. And I know, like, as town chairman, is in here. I thought his car was on. And you have people coming to the town board at just about every meeting. Well, yeah, they would spend taxpayers' money hiring a lawyer and doing this and doing that. And the key person is our public health director. It's pretty simple. If there's some things where there's contamination, it could be mosquitoes, it could be lots of different things. He's the one that makes a decision. And once we explain things to people, it's a different story.
Right, so like couple of meetings ago, I think we talked about the levels of testing that a complaint would go through. First off, it would be through the sanitarians who are doing the investigations.
Yeah.
Next level would be the health officer, then the corporation counsel's office. So there's a lot of layers of tests to be able to.
I know your office gets the initial complaints.
Yes, we do, and probably zoning and everybody else. So we decide where it belongs, and then if it's human health hazard, we take it on. If it's a zoning shoreland type of thing, they will take it on. Sometimes we work in concert with each other.
We just gotta be careful spending taxpayers' money.
Yeah, yeah.
Thank you.
Yes,
Yeah, just-
Supervisor Garvey.
Yeah, just for the benefit of the committee, I did want to say I did meet with Helen and Brian Hobbs and the Jacobs. And anyway, some of the other members. And they have done, I thought they did a really nice job kind of addressing some of the concerns I had brought up. That so the draft currently that's at corporate council is different. Because this was kind of where we were at. They wanted to bring that, we kind of walked through some stuff, address some concerns. I felt like we were kind of on the same page, and then it was going to corporate council for them to review before it came back to the committee. So I just want to say that, I guess want to call out that we did meet and that they did. I felt like I was really heard as far as my concerns, as far as crossing over from the nuisance part that was being dropped off to what was going to be updated on the human health side. So it does look different than what currently is in our packet. I just kind of wanted to call out that there has been that work done. I commend them for the work that they did and that we did meet. And so just kind of expanding a little bit on the fact that we are waiting for corporate council, but it's more than just what we're seeing in the current minutes or the current packet.
Thank you. That's good to know. And we'll look for what comes out of Corporation Council and go from there. Do we have any?
Ago, I met with the St. Clair County Corp Council and I reviewed what they had of theirs. And that's another thing, if our counties can be pretty similar in our basic drafts, that's very helpful.
Yeah, why reinvent the wheel, right? You know,
Exactly it.
especially if they've been, court tested and there's case law and, items like that. Welcome. Otherwise. Oh, I'm sorry, Supervisor Olson, do you have a comment for us?
Yeah, just a question. Is Corporation Council going through the whole draft and not just the changes that Supervisor Garvey has proposed?
The entire document was provided to Corporation Counsel's office, and we'll look through all of it and make sure that it all works together cohesively. Yep.
Okay.
Do you have anything else? I don't want to rush through. Just want to make sure everybody's ready to move on. Would be our update from our Crisis Ad Hoc Committee. Tanya and Brad?
Yeah, maybe Supervisor Olson wants to.
Yeah, Supervisor Olson, would you like to speak to it?
Well, I can. So we had a pretty good meeting in Barron County, 10 days ago, whenever it was. Good turnout. I would say a follow-up even from them. We sent another letter to all of the legislators that were there, some that weren't, being more specific and very specific as to what it was we were asking for and what we were going to do with the money and how it was going to be used. Talking to an assemblyman, it's out there. The draft that we sent them, the proposal, is being very well received. And I think we'll see. Well, I'm 99% sure we'll see legislation moving forward on what we've asked for in that letter to our assemblymen and senators. So good news all the way around, I think.
Do you want me to tell what we're asking for?
Yes, please. You probably have it in front of you. I don't.
Okay, yes. So Supervisor Olson, Administrator Norby and I met together and we are running with the idea of some upstream approaches, prevention ideas with mental health co-responders, mental health officers, recovery coaches, peer support, things that we've seen in our communities across the northern and western regions that have been working to divert people from needing to have the emergency detention. So the specific ask was an application process for counties to submit funding requests for up 1 to 3 positions, about $100,000 for each position. So Polk County would be eligible for up to 3 positions, up to $300,000 to fund for until a more permanent solution can be achieved and or in harmony with the upstream prevention stuff that we are working on. I think we put a preference for the western region just because of the gap in crisis services, crisis beds in this area. I think that's about it. So opening it up for everybody to apply for in those 33, 34 counties with the preference on the western region. Does that sound about right?
Yes.
Okay.
So we had a nice show of our committee members at the meeting in Rice Lake. So I want to thank everybody who was able to make it from our committee. It was a Friday on a holiday weekend, so I know maybe you had better things to do, but I appreciate that we were well represented there. Our county board chair was there as well. Jay Luke was there. A question I have that I don't know if anyone can answer, and I don't know how we would be able to even gather information about it, is pending Medicaid cuts. There's discussion about those hitting rural hospitals and rural healthcare. Because they depend on that funding for so many of the people who use the facilities. So I don't know if that's something that's going to come into play when we're looking at a facility or looking at hiring people, or when we're looking at doing something, with mental health and the crisis ad hoc committee. And I don't know myself, and I'm not sure how to find out if how those changes in Medicaid are going to impact the mentally ill who are able-bodied, because I've read a lot of things about, it just pertains to able-bodied people, and I haven't seen anything. I don't know how that would impact able-bodied people who have mental health issues. So I'm just throwing that out there. Like I said, I don't know how we would evaluate that or collect any information on it, or if it's going to have an impact on what we want to do and what we're trying to do or not. But I just wanted to throw that out there. Supervisor Olson, did you wave your hand?
I didn't, I didn't, but I got a comment as long as you ask anyway. Tanya, I think the higher number of the 2 in the ask, did that include northern counties as well?
Oh, the 10 to 13 million?
Yeah.
Was the western or was it?
Everybody with a preference still.
I think we believe that was everybody. We can double check that though for you.
Right, but it was everybody with a preference to the western side of the state. So if nothing else, the 12 or 13 million dollars was enough to encompass the western and the northern regions.
Yes.
Yes.
Okay. Yep, that's what I thought.
Your question regarding Medicaid, what we're looking at three potential buckets of Medicaid cuts. And actually, we are going to an event tonight that we will tell you about. Maybe in your update, we can mention that. So the 3 buckets are the reimbursement rates. And I think that's part of the issue that you're talking about, is that I saw some information on hospitals potentially going out of business. That would be related to reimbursement rates. The other piece of where the hospitals and our departments are going to feel it is in those able-bodied adults, the Badger Care Plus that might get pulled back. So looking at the eligibility requirements and people dropping off. Diana, do you know how many potentially projected drop-offs if they change that?
There's a lot of numbers right now. I can pull data from Polk County specifically, but I haven't done that yet.
So a number of people will lose their eligibility, will have no coverage, or needing marketplace, but we're hearing that there's impacts for marketplace plans as well, that it's going to become a little bit more expensive, a lot more expensive with the premiums that people need to pay. So that is a concern. And then the other concern, the third bucket that we are watching is the Medicaid dollars that funnels through the state to the counties for our funding sources. So a lot of our state contracts are driven by Medicaid. So 3 big buckets, 3 big concerns, keeping an eye on it.
Is that something, I guess, I don't know about the rest of the committee, but I would be interested in hearing after you attend this meeting, kind of an update on what new information you might have for us on that.
It's open to the public. The
Oh, it
meeting
is?
tonight is at 6:30 at the St. Croix Falls Library.
Oh,
It's being
I've seen that out
by
there.
ABC for Rural Health, who is pretty big into the federal budget and interests for the public. So they will be doing a presentation tonight on the potential effects to the community.
So if you're able to attend, Diana and we are going. I don't know if anybody else is planning on going, but if you're able to attend it, it will be beneficial. We also receive updates from ABC for Health. They're very in-depth and they are looking at all of the changes that come up through legislation and what the potential impacts are. As we receive those, I can do a blind copy out to committee members if they want to receive those updates, or you can sign up for the listserv yourself, but we can keep you informed that way also.
Yeah, unfortunately, I'm not able to attend because I have a city meeting. But yeah. Well, thank you.
Who is ABC for Health? Are they
It's an advocacy group,
an
a
advocate?
health benefits advocacy
Okay.
group, yes.
They're very prominent in Wisconsin.
Okay.
Tanya, have you got the final notice on this? The legislators that I talked to said that part of this might be reinstated. They got some drafts to reinstate.
Yeah, we haven't gotten final notice yet. on
That was
this.
my question right there.
Yep. Some things, like we heard that AmeriCorps funding was reinstated, so we're working on getting our AmeriCorps worker back. But it's all as the courts decide what gets of the executive orders, what's getting pulled back in.
Take some time to play out. Yeah, that's kind of what I figured.
Yeah.
Okay. Looks like we're ready to move on. I don't see anybody's hand up or anything. So agenda item number 9 would be our Veteran Service Officers Mid-Year Report. Thank you.
Good morning. So 2 updates. This spring, the Balsam Lake American Legion posted an event called Freezing for a Reason. Last month, they presented a check to me for $2,600 from that event. So basically that donation went towards our Veteran Service Commission Fund, which is used to help Polk County needy veterans. So if they're in a financial hardship, we can assist with certain things. So that was very, very generous of them to assist and to provide that large of a donation to us. And then kind of the other thing is still a lot of uncertainty with the VA as far as what's going to happen with job cuts. They're still talking about approximately 83,000 jobs being eliminated. Have no idea what that's going to look like yet. So still a lot of uncertainty. I'm hearing and reading things as far as motivation or morale being lowered at VA because staff are not sure of what tomorrow will bring. So still just waiting for that to play out. I have no idea if it's going to affect Polk County veterans or anything. So it's really I have. Otherwise, we're just plugging away, keeping busy.
Sounds good. Do we have any questions for Andy? No? Want to miss anyone here? Thank you and for your report, and I know you'll keep us updated.
Thank you.
Thank you for all the help with the flags on Memorial Day.
Yeah, absolutely. Yep.
Okay, on number 10, we have our child support mid-year report. Mr. Loso?
That,
Okay.
there's not a ton. We continue to be fully staffed. We have been for 2 years now. We just finished our triennial meeting with the state. They come in and make sure that we're compliant with IRS regulations, state regulations, et cetera. Our child support director had a meeting with them yesterday, went over everything, and Polk County is compliant on all issues. We have to do a few touch-up things to make sure that we're fully compliant with IRS regulations, but nothing major. Those should all be resolved in the next couple of weeks, and then we will be set for the next 3 years until we do it again. Child support numbers through this fiscal year, so our fiscal year is September to September. Our current court order establishment rate is 90%. Current child support collection rate is 77%. Paternity establishment rate is 106.38, and arrears collection rate is 64.3. So what that means is for every case that comes in, we have to establish an order in one way or another, whether it be a health insurance order or whether it be actually establishing child support in that particular case. At this point in time, 90% of the cases that have come through or been referred to us, we've established for. Not every single case requires establishment. Sometimes we try and a judge doesn't grant what we're requesting, stuff like that. But so Polk County is at 90%. The statewide average is 83.1%. So we're significantly above the statewide average. Also, that number increases as the fiscal year goes on. So as time goes on, we have more time to establish the referred orders, and then the percentage goes up. So it accumulates up through September, and then once September hits, we drop back down to, I don't know where we start, but somewhere in that area. Paternity establishment rate is one that's interesting in that it's at 106% of paternity being established.
More than one father.
So I had to look this up because it has been something that confused me for a long time. What that means is at the beginning of the year, we had 1,466 cases, and those drop off as children turn 18, and then we get new ones as new children are born. At the beginning of the fiscal year, there were that number of cases. And if you have all of those cases paternity established, your number would be 100%. A lot of those children will have been born right at the end of the fiscal year. It takes a number of months for us to establish paternity. So our number usually drops down into the 95% range, I think we were at the beginning of the fiscal year. As we establish paternity, those new cases don't get dropped into pool until the next fiscal year. So you are establishing paternity on what is going to be counted in the next year, which is how you get into the positive percentages. It's a lot of information. I just thought it was interesting. Now you all know. The point being, we're doing well. We're doing better in all of our categories than the average in the state. And we are doing similarly to how we have done in the past. We are up, I think, in our establishment rate. We're a little bit down in our current collection rate, a little bit down in our arrears collection rate, and a little bit down in the paternity establishment rate. But again, we're above the state average, and we are on pace to meet all of the state mandated, not mandated, but state desired parameters. I think they want you to be at 80% across the board. Like I said, we're at 90 already on establishment rate for court orders. We're at 77 for the collection rate. That also just keeps going up as the year goes on. So we have 5 more months to get up to 80, and the arrears collection rate also increases. For the arrears collection rate, we see a lot of seemingly big chunks of money come in. If someone sells a property and we have a lien on the property, that's a huge chunk of money that we're able to get and pay off people who are owed the money. So that's where our KPIs are right now. We're doing well. We're on pace to meet all of the standards that we need to meet. The last thing is we have a child support conference coming up in October. I think a handful of the child support specialists are going, as well as the director and myself. I take on a majority of the cases on the attorney end. Attorney Schieffer has one chunk of the letters as well. He won't be attending this year, but I'll send him next year, most likely. I will be giving a presentation on the case law update at the conference. I gave it last year with the Assistant Corporation Counsel down in St. Croix. I think the two of us will be giving that same presentation. Well, new cases, same presentation basically this year. So that's it.
Thank you. Does anybody here want to see Joe's presentation?
It will not be exciting. It is not particularly exciting even for attorneys, but
Something to think about anyways. In any event, thank you for all your work on that. And once again, just like a year ago and in years past, the child support collection process here at the county is really something to give these folks a lot of credit for. I remember we won an award for it just a couple of years ago. So campaign, get another award.
as long as we hit our parameters, I think we have a right.
You're doing a great job. Yeah, you don't have to win every year.
I apologize for being late. I was actually at child support.
Thanks, Joe.
Yep, thanks.
Okay, moving on, number 11, we have our Golden Age Manor mid-year report. Dana,
Good morning.
good morning.
All right, so I have just a few updates or information for you. First, kind of just a fun one. We have, we're fortunate to benefit in Amory from the Cycling Without Age program. So Wanda Rimstead started that program. Well, she's been working on it for several years. Last fall, they got the Trishaws. So if you're out and about in Amory, you might see some really fun Trishaws riding around or follow our Facebook page. That is just a really fun program. They're building a volunteer-based pilot. So if you know anyone that's interested, send them our way. But that's been very fun. Staffing updates. So the last few months, we've had some department manager changeover. We've had 2 retirements and 1 person relocating. Teresa's with me today. She's our new office manager. So day 2 for her. So just kind of tagging along, learning the ropes. So we have a new social services director, Hannah Polk, who was actually employed, continuing to be employed by Polk County, but she was up here as a social worker for some years before that. And then a new dietary manager, Bridget Elmer, who is new to us within the last month as well. So some changes there. We have, we're fortunate, a lot of our department managers stay with us a long time. So Christy, our social worker, had, about 35 years. And so we're really fortunate and fun to have some new faces and learning all of the ropes for everyone. International recruitment updates. So that's something I've been talking about now for a long time. And unfortunately, there's really no update. I know that's always of interest to people. In April, I got an update. That was really not an update. They were just telling me we're at least, still at least 2 years out based on the current processing time for arrivals. So something we're not, putting too much hope in anymore, but it's still out there. So we'll continue to follow along with that. CNA classes, so those continue. I believe we've had 24 individuals now through the class. We have 4 in a current class and another class starting in a couple of weeks with 4 more. So that's been just wonderful to have in the building. Survey update. So for those that aren't familiar, every 12 to 15 months, we have an unannounced survey by CMS, state survey. And we had our survey in April. So it's on site, like I said, unannounced. They look through all the regulations. They, sometimes have special focus areas, but we have about 800 pages of federal regulations that we have to follow. So it's a lot to cover, and they're usually there for the week. So this year we had a good survey. We did have citations, and in areas, I'll just give you some examples, dietary. So undated food items in the walk-in cooler. So you open a food item, you have to date it. HIPAA, so we had a computer screen that was within sight of the public that wasn't closed down. A lot of our citations this year were on documentation. So again, with all of those regulations, it's just never ending. Sometimes you feel like you could be documenting, all day long and not getting any time with the residents. So things like care plans, restorative nursing plans, pain management, those were all kind of documentation citations. And then infection prevention is another place that they spend a lot of time looking at. Hand hygiene was one of the areas, infection tracking, documentation regarding a COVID vaccine. So with that survey, they were all low-level citations. That means they don't have to come back. We just submit a plan to them and telling them this is what we've done to fix it. We'll audit these areas and then they approve us. Then we have a separate survey for life safety survey. So this year we actually had a state surveyor and a federal surveyor come, which is always a little daunting to have that extra, federal surveyor with. But so what their job is, they usually spend the day. So they were there a very long day. They look at how safe the building is in case of fire, smoke, emergencies, making sure that we're meeting all of those building standards. So again, a really good survey, especially with a federal surveyor they're usually a little more picky. But we had some minor citations regarding fire protection. We had a couple areas that they wanted a strobe for fire alarm with the fire alarm system. We had some pull stations that had to be lowered a few inches to proper ADA height, installed a few new sprinkler heads, replaced a few electrical outlets, but that was it. All of our documentation on that survey was up to date, which is great. And again, we just had to send them plan of correction, pictures, and then they accept that and no revisits. So in our world, that's a win. So, yeah, that's kind of it.
Thank you. I was just curious, Dana,
Yeah.
and maybe you can't tell me off the top of your head. So how much does Golden Age Manor depend upon Medicaid funding?
So for Medicaid, we have approximately, off the top of my head, about 70% of our residents are
Oh.
covered by Medicaid. And within the last couple of years, our Medicaid funding has drastically improved. So our Medicaid rates are better than they've ever been, which is great. It's a testament to a lot of, lobbying and advocacy through our state association. So, but yeah, typically we're 60 to 70% Medicaid, about 20% private pay, 10% Medicare Advantage, things like that.
Okay, good to know.
Yeah. All right.
Any questions for Dana from anyone? Rita, did you have a question? No. Okay, I don't see Brad waving his hand, so, okay, thank you for that. Agenda item number 12 is our administrator's update. Oh.
Just a couple updates for information. There'll be a bonding resolution coming to general government tomorrow and then on the county board. That's kind of a process resolution that for the budget that was passed last year. So we're just getting ready to lend on that money. We held off as long as we could to save a little bit of interest on that one. So also sales tax for May is still up overall, 5.9% from 2024. The month, however, is down 10% from 2024. So we're monitoring sales tax still, looking flat. Three of the current 5 months have come in under last year's projections, which is pretty common. It's usually around 6 to 7 months are below the previous years, but we're going to be very conservative when we project our earnings coming in for sales tax. We had a squad car hit earlier this month, was sideswiped on 35 at 1:30 in the morning by a side-by-side. And that person was apprehended, was looking at that, so they have them in custody. Some of the projects going on from the public works side, the repairs for the Atlas Dam are out for bid now. That's been a 5-year project, waiting on DNR to approve the drawings.
along with the Clam Falls actuators are on back order still, but however, we still are, starting to fill that pond back up again, the lake itself. DNR is allowing us to do that. We don't need to have water drawn down to install the actuators, so the gates are in and we're doing that. At Highway, they're working on some critical culvert replacements up on I. Bids for the grandstand are due June 12th, and they'll be open June 17th for that project, so we'll know where we stand on that one. Currently on our highways, we're up to 5 fatalities this year, which is never a good number. Highway projects continue to commence on County Road F, County Road B, E, and double M. And the sheriff announced the retirement of Mike Stoffel after 32 years as chief deputy, so captain. So Mike is retired now. So, and then one thing we'd like to do is, as I said at the last meeting, I have appointments coming up here, and this is Dr. Lagas's last meeting on the HHS, and we want to thank him for 30 years on the Health and Human Services Committee. I should say 30 plus. Last appointed back in 1999 with a 4-term. He's been on the health medical advisor for many years, strong supporter of public health for 3 decades, promoting healthy lifestyles and healthy lives. His family practiced for over 50 years. In addition to being on the HHS committee, he's also served on the Rotary Club, often inviting CDS staff to present on health and human services topic. He's been a part of the Polk County Medical Society and served on the State Medical Society Board of Directors representing rural public health. He's helped bring environmental health agent to the state, to Polk County from the state for hotel and restaurant licensing now including tattoo establishments. A key supporter of collaboration with Polk County Medical Centers to bring SBIRT. I love all the acronyms in HS, which is screening, brief interventions, referral and treatment around alcohol and drug use into primary health care settings. Supported Medicaid expansion, Badger Care Plus in 2010 with the Affordable Care Act, supported Polk County and the health department through various pandemics. Most recently, our favorite COVID-19, big one on that one. Received in 2018 Friend of the Public Health Award. Regularly provides HHS here with an update related to health trends, including the Dr. Osterholm report. Want to thank Dr. Lagas for all he's done for Polk County and HHS and healthcare for that. And afterwards, we have donuts and coffee and for after the meeting and stuff. But we have a certificate of appreciation for Dr. Lagas we'd like to give to him. So.
Can I take a few
Thank you.
photos?
Yes, please.
Thank you.
Stay up there.
Gonna take a
Hold on a minute, Doc.
We're gonna take some photos.
Sure.
I want to mark this moment. Thank you very much.
Can we get Miriam too? Because the 30 years didn't happen without this thing.
Without the support of Mrs. Young. Yes, please.
That's absolutely right. She permitted me to keep coming to these.
Not always permitted, but I cheered him on.
Even better.
She was my main cheerleader.
Oh, thank you for all of you for, I mean, this is one of his highlights of each month for him meeting.
Well, thank you too.
Thank
Very
you
nice.
so much.
Yeah. And don't forget this.
And that's my report.
It would be an honor for him to do this.
Well, we love having you too. I have a question on your report, Mo.
Yes.
I'm just curious. So Polk County is, does not share any of that sales tax with the local municipalities, do they?
This is the county sheriff. This is the county share that I talk about,
Okay,
specifically our share.
specifically, but the county, I was surprised. I recently learned that some counties actually, for the county sales tax, turn around and share that or a portion of it. We don't do that here, do we?
Not that, no,
No, okay,
this is just our share that we.
our share, yeah, okay. Okay, thank you.
All right, thank you.
Sounds good. Okay. Yes. Oh, I'm here. I'm sorry.
Say something?
Um, well, as my wife said, it's been an honor for me to serve Polk County for 3 decades. And I started with Bev Larson and then our most recent Gretchen Sampson,
Yep.
yes, for many years. And especially with the support of my wife, Mary. And I know that who the replacement is, and she's well qualified. In fact, I offered her my position 3 years ago when I retired from the clinic, and I offered it to 3 of my partners, and they all said they were all too busy. So finally, somebody is not busy enough to and willing to do this position. And I'm with my experience with all of you here on the board, I'm absolutely sure that you have the best intentions and a plan to look out for the health and welfare of all the citizens of Polk County. So I congratulate you all that you're willing to continue in this activity. So thank you very much for all of you for all the help that you've given me over the years. Thanks.
Thank you, Dr. Lagus. We appreciate everything that you've done, and you will be missed. Okay, I'm going to move on then to our update regarding the ADRC commercial kitchen project.
I do not have any new information.
Nothing new? Okay. Do we have an update regarding housing?
No new applications from the last individual that.
Okay. And then communicable disease report.
All right, so since January 2025, we are up to 7 pertussis whooping cough cases. We had 1 new case in May, so it's continuing to linger. We are in tick-borne illness season, 6 Lyme's disease cases in May and 1 anaplasmosis. So we are gearing up to do our tick collection. We did our first, by we, I mean Land and Water assisted. Their interns did 1 tick drag. And we are hopefully in the next couple of weeks going to have tick collection kits available at libraries and at the CSD front desk. So we're just looking at what species of ticks are around in Polk County and what diseases they're carrying. So we will just collect the ticks and send them down to the state lab of hygiene to be tested. We are continuing to watch measles very closely. As of June 5th, there is in the whole US 1,168 cases. 95% of those folks are unvaccinated and 12% are hospitalized with 3 deaths. Well, recently there are 2 new cases in Minnesota. One was related to travel, so we knew, or the health department knew that they were exposed. But interestingly, one is a child unvaccinated, and Minnesota Department of Health doesn't know where they contracted measles. So that suggests that there might be undetected community spread going on, which is more concerning. Also of concern is that child was at the Mall of America during their infectious period. So you can be infectious before you have a rash or before they have measles. So folks who were potentially exposed in the Mall of America could still be displaying symptoms up until June 14th. So we are keeping our fingers crossed there. Also, interestingly, the UP also had their first case too. So yesterday, the health department did another measles tabletop exercise. So we're practicing kind of like when we get that first report, what communications are being sent out, who are we contacting, all of that stuff. So that is all I know. Dr. Lagus.
Dr. Lagus.
Well, I read the Osterholm report last night, and there's a new variant for COVID, and there's a new Moderna vaccine that's will be coming out and has been recommended at least for over 65 and younger people who are at risk for severe disease. There's some other recommendations that people will have to figure out. And another study that they did was on raw milk. They found that live H5N1 viruses survived for 1 day at room temperature and they survived for a week in refrigeration. And of course, Campylobacter is another bacteria in raw milk. So pasteurized milk drinking is recommended, except for those people who have drank raw milk all their lives on their farms, and you know, their bodies are used to it and
I grew up drinking it.
and can tolerate it. So I think
Yeah.
we can't say 100%. U.S. has been hit by one of the largest pertussis infection, which is whooping cough. There were 10,000 cases in the U.S. with 5 deaths. 4 of those deaths were in children. And that's another vaccine preventable disease. Getting back to MMR, last month I didn't say that the R is really measles, mumps, rubella. It's called rubella, but it's really German measles, and that can cause hearing loss in kids and all kinds of other things besides just the fever and the rash. And so it's new COVID viruses, NB1.81. We'll see what happens to this, and there's still people in the hospital with COVID. So it's COVID is live and well, and we hope that the virus can be contained. That's my final report.
Thank you, Dr. Lai.
Dr. Lagerson, this raw milk, it even gets to the legislature and it's controversial. I think where the problem is us farm kids, you know, we drank it out of the vault tank and it was cooled. And the problem is if it's not cooled properly, then that's where some problem. But I'll bet you the farm kids that you treated were pretty darn healthy.
Well, the people that I treated for Campylobacter were either relatives or strangers who came on the farm and they were given raw milk to drink, and they just were not used to it.
Exactly.
So I agree with you. If you have drank raw milk all your life, you have built a tremendous tolerance to any bacteria.
Never drank anything pasteurized until we went to high school.
Yeah, I know. So
Super
I wish you all good luck.
So just a quick question I had for, so you had said that you were meeting, and if I understood you right, like your response plan, right? So how does, I'm guessing during the school year, it includes the schools. So how does that, you know, kind of, how does that redirect during the summer months as far as to try to target young populations? I'm still thinking, kind of, what is that? I'm just curious, what does that look like?
Well, we're always reevaluating our messaging. So what we send to just on our social media, Facebook posts, what messages we send to like daycares, schools, long-term care, like that is continuously every other month, probably new information coming out, new updates, status updates. Like when we talked about the Minnesota case that went out to all our community partners. But really with a response in the summer, it would be very similar as to school because there's so many like, summer school is in session, or sports are in session, like really there's students doing stuff all the time, so.
Okay, so not a huge change then just because of the time of the year? just-
Correct,
Okay,
yeah.
just evaluating, making sure you're covering all the bases. Cool, thank you. I'm just curious.
Do we have any other questions or anything? Okay, then, our legislative event report. So we did a little bit of that at our crisis summit meeting in Rice Lake. John, do you have anything for us?
Well, it was good to see everybody there. And I've been in touch with Robin Boss and Chelsea, and we're getting things ready for our annual convention in September that we're going to vote on as far as resolution. And right now, the legislature's not in session, so that's really the only important thing that's going on is what we're gonna vote on. I was also, with Rick Harvey and all you folks at Barron. And one thing, we've been at this, we're in such a disadvantage, and we're trying to get a central place. And actually, in the last legislature, they were willing to find a place for us, but we could not, the legislature did not appropriate the money to run a place. And I think somehow, at some time, these 34 counties, we're never going to get money from the I was in touch with a lot of the legislatures, people, including Duke and some of our local ones, but also some of, like, I think most of you have seen the map, like 60% of the land in Wisconsin is by less population, and 40% is in that 40% of the area. So, we've always got that to fight. And these 34 counties that we have, sometime the thing that I've been talking to some of the legislatures about is maybe we can get part of a sales tax or something, because we're gonna have to have our appropriate our own money to run a place. The state legislature is never gonna give us the money to run a facility. And I don't know, Mo, if you're ever thinking, or your people in different counties, if you talk to legislatures about if we could maybe get just even a half a cent of the sales tax, we're gonna have to come up with some funding to run this. And at some time, these 34 counties are gonna have to take the bull by the horns and say, yeah, we gotta find the money to run this if you will build a facility. And they'll find us a facility. They finally admitted that in the last legislature. That's a big thing. And so you folks, when you talk to your legislators, put a question out. Well, what do you think about maybe using some half a cent of sales tax or something? Because we got to do it ourselves. That's kind of the big thing. I met with Dana on this survey. I signed off for Polk County. There was really only 3 minor things that you were written on, and you've got them corrected. And so I spent the afternoon going through the survey with her, and I signed off for Polk County. It's been outstanding, and you mentioned a few things that they talked about, but what you didn't mention is the praise and the things that really meant a lot. They were, what I seen in that survey, they are very, very impressed on the Golden Age manner and the management and the people. And if they get complaints from the people themselves, then it would be a different story. your morale and you know, we got it now. She's working with a 1950 facility, and
Dana does a wonderful job.
most of them that were built in 1950, they're tore down and history.
I just,
It was very good. Mo, yesterday, you know, we, after all our, complaining and requests for all our life and to get Highway 65, and, you know, we got it resurfaced in Polk County. Yesterday, I took Highway 65 from St. Croix County line all the way to Ellsworth. Holy, that's state road, you know, where they got the money they're putting the second new coat of blacktop all the way to Ellsworth. I was just astonished and amazed. So state spending some money in our region. Thanks for that.
I just wanted to add just a personal note, if I may. When my mom needed to go into a nursing home in Amory, and we visited and reviewed the different nursing homes and everything. And speaking to other people in the area and friends and family who had been in the same position, they all said the same thing, that Golden Age Manor may not be as fancy or have as many bells and whistles and things, but if you, for your loved one to be treated with respect and with care, that you can't beat it hands down. And I'm not insulting any other facility in Amory, so don't get me wrong. I'm just saying, just complimenting, I know they're all good. That just complimenting, you know, the fine representation and reputation for the county.
Your people that work there, they aren't working there for the little money they make. They are so dedicated, and that's what's important.
Okay, subject matters for our next meeting. So first, we'll take a look at our work plan, what that would have in July. I believe we had those reports today. Our mid-year reports, we have budget priorities discussion, some budget updates, our public transportation update. And then as well, we will plan on having our public nuisance ordinance and discussion come back to the committee as well. And then also last month, we got the annual report. I don't know if people have had a chance to peruse that and take a look at it. If there's any questions or discussion, Supervisor Garvey had a few questions, and you know, I think there's value in having all of us talk about it and all of us, you know, kind of weigh in on that. So I think that would be a good agenda item also, is just kind of a review of that for any information or question anybody may have. Does anybody have anything else they can think of that they would like to see on our agenda for next month?
Medical examiner.
Medical examiner.
Yes, along with the new scatter plot.
Okay.
We've got the signages. We're working with highway right now to get that signage up and get it placed and get the headstone placed. So
That's always a very interesting presentation.
yeah, yeah, especially interesting with the new scatter plot.
Yes.
We've been working on that for a good year to get that dedicated and figure out the land and all that stuff. So,
I'll look forward to.
yes, yes. Can I just add to the satisfaction surveys?
Oh, I have mine right here.
So if you need one, we can run and grab you one. But I've received a couple back. So if you have it, you can turn it in today. Otherwise, we can run and grab you one to complete if you need one.
Tanya, do you know if your division don't have any resolutions coming up to the state convention?
Well, I know that they're advocating for fully funding of the community support program and crisis.
Yep.
Same as last year, so that's at. And then are there child support ones this year, do you know, Joe? But the big one, I think, is the funding for crisis and CSP. from WITSA. You guys went to the legislative event, so are there others, key points that you guys spoke on?
There was a child support piece. Do we have? There was some DCS to it.
I think also keeping the status quo for the daily rate at juvenile corrections. Lincoln Hills, so we're looking at that substantial increase. July 1st, I don't know where we're at with that.
July 1st, I have not heard any.
Do we have anything ahead of time? Because I contact other
Yep.
people to get support.
Okay, will do.
All righty, with that, I'll entertain a motion to adjourn.
I so move.
I'll second it. Okay. Motion's,
Not forget treats.
yeah, motion's been made and seconded to adjourn. Any discussion? No discussion. Let's
Aye.
put this to a vote. Everybody in favor, respond aye. Anybody opposed? Okay. We're adjourned. And yes, please, everyone stay.